Evora is revolutionary, elegant and simple.
It's just so easy, and that's what sleep should really be.
It's really about putting care into every decision we make to ensure that we're creating the best products we can.
It's so easy and so comfortable. As simply as that.
I had the privilege of starting right from the beginning of the Evora project in the initial concept development, where we were given a brief of create a new nasal mask to try and see where there were problems, where there were challenges that we could come up for solutions.
We looked at patients in their homes as to what the pain points were, and we could see patients trying to pull their masks on, even done up over their heads. That really inspired us to look at a mask that seals all around the right areas, yet is a minimalist mask, like you're just nestling your nose into a pillow. It just went from strength to strength, really, as far as developing the idea and taking it through testing and trialling and refining it to the point of the mask you see now.
So some of the features of the Evora compact mask would be the headgear and the way it holds its shape during fitting. So we have these arms that support the mask. It supports the top strap and the back strap that you can just put it over your head like a cap. We're really proud of that. So we have a knitted band which is filled with plastic. We have the ear edge feature along these arms, and that really makes it comfortable on the face, and it makes it feel like something that belongs in the bedroom.
The frame has some really cool laser drilled bias holes in it, which are able to diffuse the air to make it as quiet as possible. So while the patient is sleeping, they don't hear any of it, they don't feel any of the draft on their face, and also so that it doesn't disturb their partner.
That floating seal is actually a masterpiece of engineering technology, just because everyone's face is different. Everyone has a different nose. In every position, it's comfortable and very stable.
So what I love about Evora is the amount of technology and design that has gone in, but simplifying that the user only has to really deal with three parts: a seal, a headgear, and a frame and tube. You just connect these things back together and you're good to go.
So the testing for Evora is really around proving the device works. Some of the really cool testing that we've got here is the simulated life. So we actually put them through their paces against what patients would be doing at home. Instron tests, so force testing. We do a lot of sound emission testing to prove that the product is a really desirable device to sleep with and that it's safe and effective to go on patients.
I was brought in to look at how we can take somewhat final design and make it manufacturable. We're trying to both produce high volumes, so we want parts that are able to be produced in short cycle times, and also we want high yields, so just making sure that the parts that we are producing are also of good quality.
We're taking prototypes into production, building equipment, building processes, and designing those to make products on a large scale. We're here on the headgear lines. This is where we build the parts that go together, make the cap fit for the product. We're basically starting with a nylon material, which is on a spool, and we're using knitting machines to bring that into a consistent shape and profile that we can use to create that headgear.
A lot of that custom work that we do is built on the framework of prototyping and then figuring out we need more control, we need more flexibility, and even sometimes reliability as well. A lot of the custom machinery you see around the place, you can't buy those anywhere else, you can't see them anywhere else, and they're just things that, particularly for Evora, had to be done.
Recently, the Evora nasal mask went through a clinical validation in the United States of America, and some of the results that came out of that trial were pretty phenomenal. 98% of patients rated that they could put the mask on in the dark, and 93% of patients said it was similar to putting on a baseball cap. Some other fantastic results from the clinical investigation showed that 95% of our respiratory therapists found fitting the mask easy or very easy.
I'm really excited about Evora. We're developing products that will really change lives, help it to be easier, more comfortable.
To start from almost nothing to something you can tangibly feel in your hands and see the impact it has on a patient is a really inspiring and an exciting process.